I would like to compare the mechanisms of action and clinical results of the Biomimics 3D swirling flow stent compared to paclitaxel-eluting stents. Normal blood flow has a forward helical component referred to as swirling flow. Swirling flow has high wall shear stress, which is important because this limits the development of both atherosclerosis and restenosis. Unfortunately, the magnitude of swirling flow and therefore wall shear stress falls within the SFA and popliteal arteries, which goes some way to explain the high prevalence of atherosclerosis and restenosis in these vessels. The biomimic stent was specifically engineered to impart a helical shape to the artery that induces swirling flow, increases wall shear stress, and reduces restenosis. The computational fluid dynamics seen on your right beautifully shows laminar flow within a straight stent and swirling flow with an increased wall shear stress within a biomimic stent. The mechanisms whereby swirling flow reduces restenosis are wide-ranging and very different from that of paclitaxel. When a stent is implanted, three things happen. The wall is injured, exposing underlying proteins and damaging the internal elastic lamina and smooth muscle cells. There is a foreign body reaction producing inflammation, and there are changes in hemodynamics, specifically when a straight stent removes normal curvature and when the struts produce turbulent flow, variations in wall shear stress, and prolonged particle residence time. The resulting thrombus, inflammation, re-endothelialization, and neointimal hyperplasia are all closely related and all benefit from swirling flow. The elements that produce thrombus, activated platelets, and a coagulation cascade are blood-borne, and not unexpectedly, increasing the velocity of blood and reducing particle residence time reduces thrombus. In addition, increasing wall shear beneficially changes the expression of cellular, pro, and anticoagulant proteins. Inflammation is a major driver of restenosis and occurs following the foreign body reaction, following thrombus formation, and because leukocytes are attracted to repair tissue. High wall shear reduces both inflammation and thrombus formation. A healthy endothelium is essential for the normal functioning of an artery, and wall shear has a direct effect on the endothelial cell. High wall shear results in healthy cells and promotes early coverage of the stent. Smooth muscle cells from both the artery wall and circulating bone marrow-derived stem cells proliferate, migrate, and secrete matrix. High wall shear not only reduces thrombus and inflammation, which are the main drivers of restenosis, but also has a direct effect on reducing the proliferation of smooth muscle cells. If we look at how paclitaxel works, then my understanding is that the only beneficial effect is on the smooth muscle cells in the wall of the artery. The Biomimics clinical program is extensive, involving a randomized trial, an IDE study, and a real-life registry. All the results I'm about to show you are either core lab or independent CEC adjudicated. The Mimics RCT compared the biomimic stent against a straight stent and showed a statistically significant benefit in both patency at 2 years and CD-TLR between 1 and 2 years. The completed IDE study conducted across 3 continents showed a primary patency at 12 months of 73% and freedom from CD-TLR at 1, 2, and 3 years of 89, 84, and 81%. The Mimics 3D registry in a clinically relevant population shows freedom from CD-TLR at 1 and 2 years of 91 and 83%. Through time across these 3 clinical studies, lesion and stented length have increased, treated total occlusions have crept up to 57%, heavily calcified vessels have remained high, and 25% of patients in the real-world registry had CLI. How do these results compare against superior and paclitaxel-eluting stents? We don't have an RCT as a direct comparison, so I've shown here the results from industry-derived published data. Despite an increase in complexity of both lesions and patients treated with the biomimic stent, the outcomes are clearly comparable. In conclusion, Mr. Chairman, the biomimic stent imparts swirling flow and increases wall shear stress. That increased wall shear stress positively affects every component of the biological processes leading to reduced restenosis. The clinical results are comparable to paclitaxel-eluting stents.